Hello, my name is Tony Martin. I'm the Information Governance Lead Officer for the Trust. Information governance is the term used to describe how we handle information. And you as a volunteer are very important within this role. So why is this training needed? The simple answer is that the NHS provides a confidential service, and part of the assurance process requires all staff, including volunteers, to undertake training in this. To put this into context, patient information is confidential because the relationship between a patient and a healthcare professional is based on confidentiality, and this is supported in law and by professional ethics. The Trust, however, cannot be expected to provide a truly confidential service unless everyone who works in the NHS environment understands what information is confidential and how to keep it confidential. Without training our staff, we cannot also guarantee that everyone's understanding, a lot of which should be common sense, is the same. So thank you for your attention during this short video, and I hope you find it useful as a starting point. We all need to make sure information is kept secure and most importantly report any incidents to your immediate managers if they happen. Every one of us must help. No matter how often or how rarely we have contact with patients or information about patients, we can all report problems that we see. If we don't recognise the problems, then they may not be reported, and then we're in danger of them becoming accepted working practice. A confidential service means all NHS organisations and employees, including again you as volunteers, have a duty of confidentiality, not just the doctors or other health professionals with whom patients have direct contact. We rely upon patients' trust. Patients, and also our staff whose information we hold for employment purposes, trust the NHS to use and record that information, to look after the information securely, and only share that information with those who need to see it. Is all information the same? Working within an NHS environment, we come into contact with lots of information about people. Some of this information is limited to people's names and contact details. Much will be information about their health. Any information given to the NHS in confidence by patients is given for use in providing health care and not for any other purpose. This means the information is confidential and includes names and addresses as well as health information. It is important that you know how this information must be protected and the legal obligations that apply to this information. There are four main terms used for information that you should be aware of: confidential, personal, sensitive personal, and anonymised. So what information is confidential and what makes information confidential? The best way to explain these terms is to give an example. It's confidential because it meets three conditions. 1, it is your private information about an individual. 2, it is given to someone who has a duty of confidence, perhaps a doctor or staff who work on behalf of the doctor. And 3, it is expected to be used in confidence. The duty of confidence can of course be broken in special circumstances such as a need to protect the public, e.g. a serious crime or to prevent abuse. These situations, which would need to be justified in court if necessary, are however very complex, and as a volunteer you would not be expected to make that judgment, but instead always speak to your manager in the first instance. UK law defines personal information and sensitive personal information in the following ways. Personal information. The most obvious personal information is name, address, date of birth, home telephone number, postcode for example. It could also be your job, the school you went to, your car, or even the items that you buy that are recorded on a supermarket loyalty card. Some personal information will directly identify a person, such as a name. Some personal information can be matched to identify a person without knowing a name. Sensitive personal information is information that is protected from misuse by law because it is more likely to cause a person damage or distress. This includes information about someone's racial or ethnic origin, political opinions, religious beliefs, trade union membership, physical or mental health or condition, sexual life or criminal record. The Data Protection Act 1998 demands that we take strict care of this sensitive personal information. Anonymous information. Whenever possible, the NHS replaces patient names with reference numbers. This can often make it possible to discuss or write about a patient without identifying him or her by name. If this information is lost, then it is unlikely that the person's identity will be known. Other sensitive information. There is other information that could also be included in the lists of personal and sensitive information that are not health related. Imagine your bank details, your salary, your credit card details, passport details, or your national insurance number ending up in the wrong hands. These pieces of information could lead to someone stealing your identity, running up bills in your name, and ruining your credit rating. Certainly this could also fall into the sensitive category, and whoever failed to look after your information could end up in court for not safeguarding that information. What then makes information confidential? It's true that the information must be private and personal to someone, but it must also only be disclosed to someone who has a duty of confidence and expect this information to be used in confidence. It doesn't matter that someone has told their friends and family members that perhaps that they are in hospital, for instance. If you saw someone in a hospital corridor or in a bed or on a ward without that person giving you permission to disclose that information, then this would be or could be a breach of confidence. So now let's look at confidentiality and security. The NHS holds that personal information of millions of people, names, addresses, dates of birth, and of course NHS numbers. Safeguarding this is a serious responsibility in itself. We have discussed that our health information is in the higher category of sensitive personal information. We know that this information is confidential when it's given to healthcare professionals or their staff because it meets the 3 conditions we've looked at. We also know that anonymous information means the person cannot be identified. So why do we protect information? UK and European laws demand that personal information is protected and legal action can be taken if protection is not in place. Legal action can be taken against either members of staff or the organisation, or even both, depending upon where the fault is found to lie. In addition, regulatory bodies exist to make sure that we look after information properly, and these bodies can impose fines, or in the worst case could even order the NHS to stop handling people's information. We mentioned the importance of the public trusting our ability to protect information, so complying with the law is one reason, but the foundation of healthcare is quite simply trust. Looking after information. 2 important aspects of information governance which overlap and support each other are confidentiality measures, which restrict in confidence information to those who need it, and information security measures, protecting information from loss and theft. Confidentiality measures. The duty of confidence regulates the disclosure of written and spoken information, but of course information needs to be shared with other staff to provide effective healthcare. Confidentiality measures allow information to be shared but under strict controls to ensure the duty of confidence is maintained. Restricting what information they can have, e.g. providing the information that is needed for them to do their job, no more and no less. Staff awareness, making sure all employed staff understand their duty of confidentiality and include this in employment contracts. Contract clauses, adding confidentiality obligations and penalties for all contractors and external staff, such as IT engineers, window cleaners, who might come into contact with information. These measures are aimed at everyone who might see or overhear confidential information: cleaners, messengers, maintenance staff, IT staff, porters, caretakers, drivers, catering and laundry staff. And last but not least, volunteers. Security measures. Some information is not confidential but still needs protection, such as information which is copyrighted or has a government classification. Some information may need to be protected because it will help criminals or terrorists, such as security plans or planning for civil emergencies. Security measures protect both confidential and non-confidential information. The measures are grouped into 3 types. Physical measures, such as walls, fences, gates, lockable doors, windows and cabinets, security lighting, and the list goes on. People measures, such as character, references, vetting and background checks, awareness, education and training. And electronic measures, such as CCTV, intruder alarms, password or encryption. Security measures will be supported by policies, procedures and guidance to make sure all staff know what to do. A key principle of security is to overlap security measures to avoid a situation where only one measure protects against a risk. The danger of relying on one single measure is that it may not be 100% reliable, or worse, it may fail completely and without warning. People measures. As a volunteer, you are vetted and your character references are checked. You're issued with an ID badge and a uniform, which is handed back when no longer required. You're trained to recognise and report security incidents, and you're trained in information handling specific to the tasks that you do. Physical measures. Patient files, when being transported, are contained within sealed bags or envelopes. Files on wards are secured in cabinets. Doors, windows in departments are lockable, and only authorised staff are allowed access. Electronic measures. Systems are only accessible with password and smart card controls in place, patient files are barcoded and trackable, and a file recall system is in place. As you will have noted, a lot of time and effort may be spent planning security, yet the most important factor to success or failure is actions of staff. Probably the worst position for an organisation is not knowing that a risk exists or has increased, or that security measures are not working. The necessary measures are often put in place too late, after the incident has happened. That's why it's so important to report weaknesses, as well as incidents, and for us, the trust, to listen, and more importantly, act. Personal information given to the NHS is nearly always confidential. During your time here, you may come across information governance related issues which could lead to an information governance incident. Here are just a few examples of the type of incident which have occurred. On the photocopier. At the photocopier, you find a pay statement left in the machine. It is a hospital employee's. What would you do with this? In the corridor. In the corridor, you find a sheet of paper. When you pick it up, you find that it is a list of patients currently on a specific ward. How would you react? In outpatients, a member of staff asks you to take a patient's records to an outpatient clinic in another area of the hospital. What security measures would you need to consider? In the hospital restaurant. In the queue, you overhear two members of staff discussing a patient's care. The patient is clearly identifiable from the information that's being said about them. What would you do? On social media, you see a post on Facebook which includes a photograph of a patient on a ward which was taken at the hospital on someone's mobile phone. In the background of the photograph, you can clearly see other patients. What would you do in this instance? The main purpose of this video was to give you an introduction to the trust's expectation for you as a valued volunteer. As mentioned already, all staff, including volunteers, are required annually to complete e-learning on this subject. So your line manager will discuss with you what you need to do next. The training will also provide you with a general understanding of the Trust's information risk management approach and the local and national information governance policies associated with this subject. Thank you. And remember, if you're unsure of what to do at any time, then please speak to your line manager in the first instance, or of course you can always contact myself or my team in Information Governance.